Hello, this is Dr. Marty Harris, and today's topic is Autism Spectrum Disorders. Perhaps the most mysterious disability is autism. For many years, professionals viewed people with autism as emotionally disturbed or mentally retarded. This disability has forced professionals to think differently about how the brain functions and processes, as well as defining characteristics of intelligence. Understanding the definitions associated with autism spectrum disorders will help us understand the learning and the behavioral characteristics of students with ASD. Autism was first recognized early in the 20th century, although it existed for centuries. In 1980, it was officially acknowledged as a disorder by the APA, American Psychological Association. In 1990, it was first considered a disability category under IDEA. Dr. Leo Kanner was a child psychologist at Johns Hopkins Medical Center. He defined autism in 1943 and used the term early infantile autism. He believed these children could be distinguished from those with schizophrenia. He selected the term autism because autos in Greek means self. Let's look at Dr. Kanner's criteria. Normal physical appearance, difficulty relating to others in a typical manner, extreme aloneness that seems to isolate the child from the outside world, extreme reaction to loud noises, resistance to being picked up or held by parents, significant speech deficits, including mutism and echolalia. Some had good rote memory, early specific food preferences, obsessive desire for repetition and sameness, bizarre repetitive behavior such as rocking back and forth, lack of imagination, and few spontaneous behaviors such as typical play. As we examine IDEA's definition of autism, compare it to Dr. Kanner's original criteria. Autism means a developmental disability significantly affecting verbal and nonverbal communication and social interaction, generally evident before age 3, that adversely affects educational performance. Other characteristics often associated with autism are engagement in repetitive activities and stereotyped movements, resistance to environmental change or changes in daily routines, and unusual responses to sensory experiences. The term does not apply if a child's educational performance is adversely affected primarily because the child has serious emotional disturbance. Disorders included in ASD. Spectrum implies similar characteristics but a great variance within ASD. ASD includes 5 syndromes: autism, Aspergers syndrome, Rhett syndrome, childhood disintegrative disorder, acronym CDD, pervasive developmental disorder not otherwise specified, acronym PDD-NOS. Among the 5 syndromes, there are 2 differentiation factors. 1. Age of onset. 2. Severity. The criterion for each of the 5 syndromes are set by the American Psychological Association. Let's go through each of the 5 syndromes. Number 1, autism. 3 defining features with onset before age 3. 1. Problems in social interaction. 2. Problems in communication. 3. Restrictive, repetitive, and stereotyped patterns of behavior, interests, and activities. Let's look back at communication. Delayed language, total absence of spoken language, echolalia, which literally means they keep repeating and repeating and repeating what they hear, reverse personal pronouns. So instead of saying, I want a drink, they will say, you want a drink, even though they mean themselves. Difficulty with understanding or forming semantic categories. 50% of children with autism do not talk as a way of communicating. 50% of the children with autism use spoken language, but much of their verbalizations are repetitive or echolalia, or use incorrect semantics or incorrect pragmatics. 75% of the children with autism have mental retardation, and 25% have typical intelligence. Thus, the terms low-functioning autism and high-functioning autism. High-functioning autism should not be confused with Asperger's syndrome. Included in the group autism is a subtype referred to as autistic savants. Savant is the French term for gift. These individuals have an area of extreme giftedness or talent, such as the character Raymond in the film Rain Man. His gifts were the ability to count and memorize. Number 2, Asperger's syndrome. Dr. Hans Asperger, a German physician, described a form of autistic-like behaviors found in 4 cases in 1944. 2 notable differences. 1. Average intelligence. 2. Language perceived as normal. Initially, the term was autistic psychopathy, eventually called Asperger's syndrome by Lauren Wing in 1981. We have adopted that term. Note, there are no burgers in Asperger. It is pronounced with a P, and it's spelled with a P. As long as we are on the correct terminology, Asperger's syndrome should not have an apostrophe S after Asperger. The syndrome did not belong to Dr. Asperger. It was named after him. So let's look at it now. Number 1, impairments in all social areas. 2, these children do not have language delays and often develop language early. 3, most have average or above average intelligence. Let's go back to the social areas, particularly an inability to understand how to interact socially, problems reading facial expressions, body language, social cues, and in understanding jokes, problems understanding and reading the emotions of others. Other characteristics for Asperger's syndrome. 1. Repetitive and stereotyped behaviors and perseveration. 2. Intense interest in one subject area, often atypical things or parts of things, to the exclusion of everything else. 3. Clumsiness, difficulty with fine and/or gross motor activities. 4. Impaired use of nonverbal behaviors related to social interaction, such as eye gaze, facial expression, body posture, and gestures. 5. Inflexible adherence to routines. 6. Superior rote memory, tendency to amass many related facts. 7. Difficulty judging personal space. 8. Difficulty understanding others' feelings. 9. Odd speech patterns, perhaps rhythm or monotone, or a very formal style of speaking. 10. Extensive vocabulary. Reading commences at an early age. This is called hyperlexia. Perfectionist, frustrated when asked to submit work one feels is below standard. Number 3. Rhett Syndrome. It is a genetic disorder that occurs only in girls. They have normal development in early infancy, followed by a regression. Onset is between 5 and 30 months of age. Loss of skills include purposeful hand movements replaced with hand wringing, social engagement, uncoordinated gait or trunk movements, and loss of expressive and receptive language. Number 4. Childhood Disintegrative Disorder, acronym CDD. This is a rare disorder and the least well understood of ASD disorders. More prevalent in boys than girls. They have normal development up to age 5 or 6. They lose already acquired skills, language, social, motor. Their behavior patterns become similar to children with autism, restrictive, repetitive, stereotypic, and they continue to regress. Number 5. Pervasive developmental disorder not otherwise specified, acronym PDD-NOS. The PDD aspect of this disorder indicates characteristics are similar to autism, but to a lesser degree. Specifically, we are talking about 1. Social interaction, 2. Communication, and 3. Restrictive, repetitive, or stereotypic behaviors. Variance in onset and degree of difficulties. The symptoms may include mild difficulties in all 3 areas. May not display difficulty in all 3 areas. May have early onset or later onset than age 3. NOS aspect of this disorder indicates the symptoms do not match other ASD disorders, Asperger, Rhett, or CDD. Finally, let's talk about intelligence and ASD. Remember that average intelligence range is from 90 to 110 IQ, -1 standard deviation to +1 standard deviation. So where are the children with ASD on the bell curve? Let's look at autism first. 75% of the children with autism have mental retardation, but 25% have low to average IQ. Children with Asperger syndrome fall in the low average to high average. Some may have splinter skills. What's a splinter skill? It's one particular thing that you're extremely good at. Children with Rhett syndrome and CDD start out in the average range, but they regress into MR. How sad that must be for the parents. Children with PDD, NOS, have low average to high average, and 10 to 15% of these children have splinter skills. There is another group, Autistic Savant Syndrome. Yes, they do have mental retardation. They have great difficulty with some adaptive behavior skills, but they have one or two specific areas that are extremely gifted. Watch the next YouTube videos about autistic savants, Tom Wiggins, Stephen Wiltshire, and Leslie Lemke. They will amaze you. With education that is special, that focuses on the individual child with ASD, we can find their gifts. Remember, education should be special. Thanks for listening.